What's up, everyone? Dr. Eric Jackson here. Thought I'd sit down with you today a little bit in between patients and talk about a very common topic I get asked a lot about, thumb sucking. Pediatric thumb sucking. A lot of the why and how do I stop it and is it really that bad? So let's go through it just kind of real briefly here. First off, a lot of the questions I just touched on. Why does it happen? It's a totally normal developmental process. Thumb sucking is a self-soothing type mechanism. It's very natural. It gives the child a sense of calmness and whatnot, especially when they're going through separation. You'll find it at night, of course, when they're separated from the rest of the family in their crib or their bed. My children have all done it, and it works out just fine, which will bring us to our second point. Well, when do they usually stop? Well, they stop most children stop on their own, without a whole lot of effort. They just kind of grow out of it, frankly, between the ages of 2 and 4 in general. Now, no child is the same, so it's something that, much like tooth eruption or any kind of pediatric development, every child will be a little bit different, and so you kind of have to play it by ear as a dental professional or as a parent. Why are we so concerned about thumb sucking? Well, that's a good question. So thumb sucking, and it's close, and we'll touch on this too, pacifier use. Thumb sucking, it's not the end of the world, right? There are many worse things out there than thumb sucking. So let's just put that out there and be honest, because sometimes I've got 4 children. We parents get really focused on how we have to improve things or how we have to start a behavior or stop a behavior. And I'm just going to be the first to tell you that it's not that bad, right? It's just not that big a deal. But it is a negative habit, right? Thumb sucking depends on the amount of the suck, the voraciousness of the suck, and the duration of the suck. So some kids are very light thumb suckers, and they might suck their thumb all night long very lightly. That might not be that big a deal. As far as changing their teeth positioning, changing the shape of their roof of their mouth, the palate, all those things can be very easily altered by thumb sucking. Conversely, a child could be a voracious thumb sucker, a very high suck and a big seal on the tooth, a big seal on the thumb rather, and making sure that they really are always just sucking on that thumb. That suction effect will eventually change the tooth position, the bone, and so on and so forth. And we don't really want that. It'll narrow the palate, it'll bring things up. You can start seeing a lot of these problems as early as age 5. So we want to have the thumb sucking out of the way, certainly before age 5. If possible, you aim for 4 years old. And if you have to, you kind of work with your dentist or your orthodontist and go from there. Our pacifiers, I touched on it earlier, our pacifiers are a better alternative. Well, better is a tricky word there. Pacifiers are easier to take away than a thumb, that's for darn sure. Coming from experience, now all my kids were thumb suckers, and so you obviously have to address that. But if your child takes to a pacifier, it's going to cause the same, or at least similar issues as a thumb sucking, but you have the ability to go cold turkey and just flat out just take it from them, and then that solves the problem. What do you do about a thumb sucker? Well, the first thing is, you shouldn't scold the kid. It's not the kid's fault. They're not doing something bad. It is a normal, soothing behavior, but we want to make sure we try to work the psychology a little bit. When I've got a patient coming in, young patient, we'll perhaps talk to them about how important it is that they listen to mom or dad or grandma and grandpa or whoever brought them to the visit. We'll talk about maybe they'll get extra stickers or some extra swag next time they come in. If they can really work hard and not suck, and have us tell them they're not going to be sucking their thumb next time, it works really well. It works really well to involve somebody outside the home, like a dental provider, to really drive that message home, because it's somebody that's not the norm, right? And often you get a lot of good traction from that. We want to try to make sure that it's just a normal part of development and not something, a part of something bigger like anxiety or whatnot. So keep an eye on all that. We want to make sure that the child has the ability to thrive without being in an anxiety-ridden environment, which might cause them to suck their thumb and et cetera, et cetera. Talk to your dentist about it. I mean, ultimately, it comes down to we dentists see these children every 6 months for cleanings. We watch them grow up, especially when they're young. The medical professionals don't often see them every 6 months. Usually it's annual checkups, things like that. So let us know. We found that most of my children outgrew thumb sucking on their own, but they sometimes benefited from a mechanical barrier. My daughter we ended up putting a little sock on her hand with a little bit of sports tape around it, so she was physically unable to place the thumb in her mouth. I know that there are several products in the market that are fancier versions of that, kind of an anti-thumb sucking sock, if you will, that goes on the hand, and there's a little clasp and whatnot. I haven't personally used them. Let me know if you have, but they certainly make a lot of sense because ultimately it comes down to mechanically preventing the thumb going in the mouth. It's going to be successful. Don't forget the tried and true that works for many people. The paint, the nail polish is what I'm trying to say. That's why I got stuck up there, right? Painting that nail polish, it tastes very bitter. And so when you put a little bit of that on the thumb, and then you can go ahead, when they suck their thumb, they're going to have a rather bitter, foul taste, and it's going to be aversion therapy, and they're going to slowly stop or quickly stop. I've seen both. I've also seen some kids just power right through it and just suck the bitter right off. They get, tough it out, and then they're back to their glorious thumb again. For those children with that really, really entrenched habit, have no fear. I like starting with the mechanical and maybe some of the little polish and whatnot. But then you talk to your dentist. Odds are he or she's going to talk to you about perhaps discussion with an orthodontist. The orthodontist can apply a tongue crib or whatnot into the child's mouth as a mechanical deterrent as well. Those are very effective. But I like kind of working my way up to that as my own personal and professional opinion there. I think it's really, really good. And if need be, a lot of this is fringe dentistry, which I love fringe dentistry. It's multidisciplinary, right? You're taking your dental knowledge and applying it to medicine as a whole. Like the video of our prior video, DDS versus DMD. We are part of the medical profession. We're not just the standalone island here. So if all these, and you keep, if the child isn't successful, if these methods aren't working, we'll bring in some outside opinions. Perhaps talk to the child's pediatrician or MD. Perhaps talk to perhaps a child psychologist would be in order, because sometimes the bigger picture is needed to be seen outside the mouth. And that's not necessarily our turf, but we can kind of help nudge people left and right to at least go get a consultation from the right people. So those are some things that I'd like to suggest. Again, to summarize, don't worry. Thumb sucking usually resolves on its own. Every child develops at their own pace. We want to get taken care of before school starts, that's for sure, if possible, because we don't want to have that child subjected to daytime thumb sucking and potential ridicule from classmates. Children, they don't have filters, and they can be quite cruel sometimes. So working hard on this when the child is 3, 4, 5 years old, very important to try to nip it in the bud as early as possible. In addition, we want to make sure we avoid any anatomical changes. Yes, those can be fixed a little bit later too, perhaps at that orthodontic consult when they're 6, 7, 8 years old, give or take. But with that said, why not prevent it, right? So I'll leave these thoughts at your doorstep. Let me know your thoughts, if you would please, in the comments below. I love making these videos. I love hearing back from you. Give me your thoughts about all the different types of things we talked about here today, but especially I'd love to know if there's any techniques, products, ideas that have been worked well for you, your children, in your dental practice, your patients, anything. Put it in the comments below. Everyone will benefit from hearing them, or from reading them rather. And of course, if you like the video, hit the thumbs up button. If you like the channel, subscribe and make sure you hit the bell. Love to have you on the subscriber list. We're growing quickly, and it's just a wonderful feeling. So thank you so much. Have a great rest of your day, and I'll talk to you in the next video. Bye-bye now.